So now we'll discuss about staging of C ovary. So this is 2021 FIGO staging. Broad headings. Stage 1 is tumor confined to ovaries or fallopian tube. So as usual, tumor is confined to ovaries or fallopian tube. Then stage 2. Stage 2 is tumor confined to ovaries or fallopian tube along with pelvic extension. That means it is below the pelvic brim. Pelvic extension or peritoneal cancer, or that is below the pelvic brim. So if it is involving the below the pelvic brim, then it is stage 2. Then stage 3 is one or both ovaries or fallopian tube is involved, or peritoneal cancer is there with cytologically or histologically confirmed spread to the peritoneum outside the pelvis. So if it is involving outside extra pelvic and or metastasis to the retroperitoneal lymph node, that means again I am telling involving one or both ovaries, fallopian tube or peritoneal cancer with cytologically or histologically confirmed spread to the peritoneum outside pelvis, that is beyond pelvis. So it is not involving the pelvis here, it is involving beyond pelvis, so above the pelvic brim. That means if it is involving above the pelvic brim, then it is stage 3. Okay, that is extra pelvic and metastasis to, as usual, stage 3 is retroperitoneal lymph node involvement. Then stage 4 will be distant mets. So stage 4 is distant mets. Okay, so in details now. Stage 1 1A. 1 is tumor is limited to one ovary. 1A tumor is limited to one ovary. Catch क्या है ना, capsule intact. Capsule should be intact. One ovary or fallopian tube with capsule intact, and there is no tumor on the surface of ovary or fallopian tube. That means ovary and fallopian tube surface is not involved. So see, there is a tumor here. So this is the uterus, fallopian tube and both ovaries. Now the tumor is there. Tumor is 1A, that is only one ovary is involved. The tumor is not on the surface and there is no malignant cell on ascites or peritoneal vasing. Now 1B means tumor limited to both ovaries or fallopian tube with capsule intact. Remember, in both these cases capsule is intact, so tumor is not on the surface, tumor is inside. Here same thing, no tumor on the surface of the fallopian tube and no malignant cell in ascites and peritoneal vasing. So 1A and 1B, basically 1A simplified, 1A is one ovary and 1B is both ovaries or fallopian tube with capsule intact, and in these both cases capsule is intact, no tumor on the surface and no malignant cell in ascites. Then coming to 1C. 1C is tumor limited to one or both ovaries, but 1C1 is again, it is 1C1, 1C2 and 1C3. 1C1 is surgical release. That means you are doing a surgery for ovarian cancer, you are doing staging laparotomy. During the surgery, the ovary ruptured or the cyst ruptured, malignant ruptured, then the malignant cells they spill into the whole peritoneum. So it is 1C1. So now the staging has changed to 1C1. So we will call it as surgical spill. Second, if the capsule ruptured before the surgery, then it is 1C2, or the tumor has come to the surface of the ovary, it is 1C2. So see, if the tumor has come to the surface of ovary, then it is 1C2. Okay, and now before starting of surgery, during staging laparoscopy or after opening the abdomen, we will collect the peritoneal vasings. So if these peritoneal vasings comes out to be positive, the peritoneal vasings comes out to be positive, then malignant cell or peritoneal vasing is positive, then it is 1C3. So 1A means one ovary or fallopian tube, capsule intact. 1B means two ovaries, both ovaries, capsule intact, that is 1B. 1C means three types. 1C1 is during surgery the cyst ruptured and surgical spillage is happened, and in 1C2 capsule is ruptured before surgery or tumor has gone onto the surface. That is 1C2. And 1C3 means the malignant cell is present in the ascites or peritoneal massing. That is 1C3. Okay. Then coming to stage 2. Stage 2 means tumor involving the one or both ovaries. Along with that, there is some pelvic extension. That means now the tumor is not in the ovary or fallopian tube. It is gone into the pelvis. That means it is gone into the pelvis. That is pelvic extension, but it is below the pelvic brim. So below the pelvic brim, that is stage 2. In 2A, involving the uterus or fallopian tube or ovary. So it is, if it is involving the uterus only, then it is 2A. If it is beyond uterus, extension to the other pelvic interpersonal tissues, it is other structures, then it is other pelvic structures, then it is 2B. So 2A is only uterus, 2B is beyond uterus, that is other pelvic structures. Next is stage 3. So in stage 3, I have told that stage 3 is little bit difficult to remember. Stage 3 is tumor involving one or both ovaries or fallopian tube or peritoneal cancer, that is involving the peritoneum, or with cytologically, peritoneum means it is below the pelvic brim, with cytologically or histologically confirmed spread to the peritoneum outside pelvis. That means outside pelvis means, suppose this is the pelvic brim, and now the tumor has gone into the above the pelvic brim. So this is stage 3, outside pelvis. That is the peritoneum is involved. Here the peritoneum is involved. If the peritoneum is involved, then it is extra pelvic peritoneal involvement. That is called extra pelvic peritoneal involvement. That is stage 3. That is beyond the pelvic brim. This is pelvic brim. It has gone beyond the pelvic brim to the peritoneum and or mates to the retroperitoneal lymph nodes. So stage 3A1, there is 3A1, 3A2, 3B, 3B, 3C. So I have drawn a line between 3A1 and 3A2 because these are completely different. So you can connect with 3A2, 3B, 3C and remember 3A1 separately. So 3A1 is positive retroperitoneal lymph node only. There is only lymph node positive. That is cytologically or histologically. That means you have taken a biopsy. Or you have, during surgery, you have taken the lymph node dissection, done the lymph node dissection. After dissection, the lymph node comes positive or positive, histologically confirmed. Then there is 3A1, positive retroperitoneal lymph node only. So we can again 3A1I and 3A1 double I. I means one, single I means less than 10 mm size, and double I means more than 10 mm size. Then coming to 3A2. 3A2, 3B, 3C, remember at one time. What is 3A2? Now you see the tumor has gone into the to the peritoneum. Here, the peritoneum. But how much size? So it is 3A2. If it is microscopic, I cannot visualize, but if after taking the biopsy, that it is involved, microscopic extra pelvic above the pelvic, extra pelvic peritoneal involvement, that is above the pelvic brim, peritoneal involvement with or without retroperitoneal lymph nodes. Retroperitoneal lymph nodes may be involved, may not be involved. That is 3A2. 3A2 means it is microscopic. So very small structures are very small. Microscopic extra pelvic, that is beyond the pelvic brim, above the pelvic brim. But 3B is macroscopic. I can see macroscopic, but it is less than 2 cm size. So it is macroscopic. Less than 2 cm size. Extra pelvic peritoneal meds with or without retroperitoneal involvement. Same thing. So it has gone beyond the pelvic brim. This is pelvic brim, but it is macroscopic, but less than 2 cm size. So it is 3B, macroscopic, less than 2 cm, less than or equal to 2 cm. Then coming to 3C. 3C is macroscopic but more than 2 cm. Same thing again, extra pelvic peritoneal involvement, metastasis with or without retroperitoneal lymph node involvement. So if it is more than 2 cm size, so that is macroscopic, more than 2 cm. Then again another point is capsule of the liver and spleen involved without parenchyma. That is also 3C. This is important question. If the capsule is involved without parenchyma, that is 3C. Then, but parenchyma is not involved in 3C. Then coming to stage 4. Stage 4 is distant mates. In distant mates, 4A. 4A means pleural effusion with positive cytology. Lung is involved. There is pleural effusion in the lung, but with positive cytology. Then you can confirm that is 4A, just like CA cervix. Biopsy proven should be there. So it is positive cytology. Then 4A. In 4B, parenchymal mates. Parenchymal mates means involving the liver and spleen. If it is involving the liver and spleen parenchyma, then it is 4B. And extra abdominal organs like inguinal lymph nodes, then it is 4B.